Hi, and welcome to the Healthy Built Environment for Health Professionals Training Series. Today, we are very excited to have Dr. Karen Rideout, who will be presenting her presentation titled Working with Evidence. All right, I'll pass the mic off to you, Karen.
Thanks, Kelsey. And I'd like to thank the organizers of this training for inviting me to speak to you. I am an environmental health policy analyst at the BC Centre for Disease Control and also affiliated with the National Collaborating Centre for Environmental Health. And it's the National Collaborating Centre hat that I'm going to wear today and speak to you about some ways that you can work more effectively with evidence to support your work around healthy built environments, particularly within a health authority context. So before I get into that, I'm just going to give a really quick overview of where I'm coming from with the National Collaborating Centre. So the National Collaborating Centre for Environmental Health, or NCCEH, is one of 6 national collaborating centres for public health that are across Canada. And this is a program funded by the Public Health Agency of Canada to support public health policy and practice across the country. And each of these 6 NCCs is affiliated with a different agency in a different province, and each one deals with a different aspect of public health, and they're up on the map on your screen. The NCCEH is housed within the Environmental Health Services Division at the BC Centre for Disease Control, and we're here in Vancouver. And we support environmental health practice, programs, and policy in Canada through synthesizing, translating, and facilitating the exchange of knowledge, through identifying gaps in research and practice-based knowledge, and through building capacity through networks of public health practitioners and policymakers. I'm also going to be referring to some resources that have come out from the NCC for Methods and Tools, and they are based at McMaster University in Hamilton, Ontario, and they do a lot of work around using evidence as well. So a quick overview of what I'll be speaking about today. I'm going to introduce a couple different ways of approaching evidence depending on the amount of time and the resources that you have available to use. Then I'm going to go into a bit more detail about how to actually search for evidence, particularly when you are constrained in terms of time and library resources. And I'll then work through 3 different scenarios that are really common in environmental health research, and particularly around using the healthy built environment literature. Something that often happens is we'll do a search and there's either too much evidence, too little evidence, or the evidence is really variable and seems conflicting, but we still need to figure out how to use this evidence to make decisions in our work. So we'll talk about some approaches on how to deal with those scenarios. And then finally I'll close with some comments about how to actually use the evidence in your day-to-day work. And just to point out that some of my slides will have this little piece of paper icon up in the corner, and whenever you see that, that means that there's more information about what I'm talking about on a handout sheet that was provided in the training and is going to be available on the PlanH website where these slides are posted as well. So you can go to those links to get additional information. So approaching the evidence, of course, with many things we do in our jobs, there's maybe 2 main ways that you can approach reviewing the evidence. There's an ideal, or what we might call a gold standard method, which would be great if we could all do this all the time, but the realities of our world don't always allow that. So then there's what I'm calling a rapid and realistic approach, which is the way that most people actually do things in practice because we are working with a range of constraints that we have to deal with. So normally when someone from the NCCEH gives a presentation about using evidence, we go through the gold standard method, and it's a very detailed method of evidence-informed decision-making for environmental health. And this is a really fantastic process and will lead you to strong evidence-based decisions. However, it's also very time-consuming. It requires a certain amount of training and a fairly high skill level in evidence review, and it also requires access to some academic library resources that can be restricted, and a lot of health authority staff may not have access to these. So in preparing for this presentation, I tried to think about these constraints that environmental health officers and others working in health authorities might have, and I came up with an adapted approach of this evidence review method that I hope will work for most of you. I'm calling it the rapid and realistic approach. It's a lot quicker. It can be done with tools that are freely available, but also fits with if you have access to academic libraries, those things can certainly be used as well and will strengthen your search. It also takes into account a lot of the limitations in the evidence base around healthy built environments, and should help you apply this evidence to the various kinds of issues that you're working on through this topic. So before I get into this rapid and realistic approach, I'm going to refer you to the gold standard, and this comes from the National Collaborating Center for Methods and Tools, who have developed a 7-stage approach to evidence-informed decision-making. And I would highly recommend that everyone explore this further, particularly if you're doing comprehensive literature reviews, but even for day-to-day work where you don't need to go into quite so much detail. It's very good to know this system and understand the process, even if you aren't going to go through all of these steps every time you search for evidence. In particular, I would refer you to the link on the screen, and it's also on the handout, and there are 10 online learning modules. Actually, it's a certificate program you can do through the NCCMT. And there are also 2 brief introductory modules, and these introductory modules are a really great place to get started and familiarize yourself with this process. They take about an hour each, and you can do them at any time, so really good, just basic background for anyone who needs to use evidence in their work. So onto the rapid and realistic approach. I've broken this down into 5 kind of quick steps for healthy built environment staff to use. And really this is for those of you who don't have time for extensive training, who may not have access to the university library, or just the time to do a really systematic search and appraisal process. And this is actually how I often work, even though I have the ability to do a more systematic review. Not every situation that I work on requires that much, and I'm often constrained for time as well. So this is more approach that I would use for a lot of different situations. So the first step is to look and just get to know what resources you have available, get to know your topic and refine the kind of questions that you're going to be asking of the research. Then you get into actually searching for evidence and evaluating it and sorting it. And then you have to assess the evidence that you find, and this is where we get into this common problem of either having too much or too little evidence available and trying to deal with that situation. And then finally, based on the evidence you've collected, you need to make a decision or a recommendation that's based on that evidence. So in this presentation, I'm going to quickly go through these first 3 steps, and I'm going to focus a little bit more on what to do in these when you need to assess the evidence and there's either too much, too little, or it's conflicting. So the first step is to look, kind of get to know the lay of the land with respect to your own resources and what you're able to do and what you actually need. So you need to consider how much time you have. Do you need an answer in a couple of hours, or do you have a few weeks to spend on this? What skills do you have at your disposal? And this might be your own skills, whether you have training in evidence review, but also consider the resources that might be available within your health authority. Some health authorities do have information specialists, or what we commonly call librarians, and these people can be a huge help in guiding you through a search for evidence. Here at the NCCEH, we're really fortunate to have a fabulous information specialist, Michelle Weens, and she's really great at helping to scope out research questions, finding search terms, and just really knowing where to look to find different kinds of information. So I encourage you to find out if you have that kind of a staff person or resource at your disposal. Then you need to find out if you have access to an academic library and their search databases, or access to academic journals. So, here in BC, that's usually going to be either UBC or SFU libraries, or UVic. And if you do have an information specialist, he or she can help you answer those questions and get your library access. And if you do have this kind of access, there's really great databases to search for health evidence. So Medline, Academic Search Premier, and Web of Science are some of the top ones that I would recommend using. Another one that's also freely available is PubMed, which is quite similar to Medline, but you don't actually need library access to use that. And then if you don't have a library, you can also use Google and Google Scholar as alternatives. They're freely available to anyone. They do cover a broader variety of information sources, so not as specific, but I'm going to give you some tips on kind of how to get the most out of searches using Google. And then finally, and I'm going to speak to this a bit more later, but I strongly encourage you to use reference management software. I really can't say enough how valuable it is to help with your searching, organizing the sources you find, and then actually using your evidence if you're writing a report and need to cite sources. If you've got access to purchase software such as EndNote, that's a really great one. It's very intuitive, easy to learn, and trust me, it will make your life a lot simpler. Otherwise, there are freely available options. There's a couple software options. One is Mendeley, the other is Zotero, and you can use these online or you can download a free desktop version. And Google also has a tool for organizing evidence search results through Google. That's also available online, and I'll show you how to use that. So once you know your resources and what you've got to work with, you need to get to know your topic a little bit better. And if it's a brand new topic, you can do some really quick internet searches just to learn a little bit more about, you know, what might be a brand new area. And then think about what you really need to find in the evidence. You don't need to know everything about a particular topic. You really need to think about a question that you're trying to answer, and that will help you narrow down your search. And I'll talk a little bit about that in the next couple slides. But before I do, just another point that probably goes without saying, but it's always good to be reminded when doing a literature review that we are looking for evidence about a particular topic or a relationship and not looking for evidence to support something that we want to do. And what I mean by that is that it's really important to always remind yourself to take a balanced view of the evidence and objectively assess what it's saying. And this is particularly important now that, you know, through Healthy Built Environment teams, health authorities are doing maybe more advocacy work than in the past. And I think the strength of that is that as health professionals, we have a very strong voice in bringing health evidence to planners and local governments because we're seen to be a really credible source and seen to be unbiased. So I think it's particularly important in this area of work that we stay vigilant to present that evidence in a balanced way. So back to clarifying your question, whether you're trying to, you know, reframe or clarify, there's some simple tools to help you make a really clear question that will help you get the right evidence that you need. And these are these PICO and PICOS type tools, which I'll explain on the next slide. So you may have seen these acronyms of PICO or PICOS before. They're fairly common in health research, and they're just really helpful guides to help you structure a really clear question, to clarify what it is you're looking for in terms of what's the population that's affected, what kind of intervention are you interested in, you know, and what outcome is particularly important. So are you looking for outcomes about particular chronic disease or about use of a particular built environment tool or intervention or what have you. PICOS just adds in study type, and this will just narrow down your search a little bit more. And then this third one called SPIDER is something that will, if you use these sort of terms, it may be more specific. You won't find as many results if you use these parameters, but it's a lot more suited to incorporating qualitative research and literature from fields outside of health. So if you're looking at the planning literature, for example, the way that this SPIDER tool lays things out might be a bit more useful for you. And you can get more information about these from the links on the accompanying handout. So once you do have a research question, then you need to turn it into search terms. And the search terms are the words that you actually plug into your search engine like Google or a library database. And there's two main kinds of search terms. One are what's called MESH terms. These are medical subject headings. And these come from the U.S. National Library of Medicine. And these are what are used in the academic library sources. So if you're searching with Medline or PubMed, these are really useful terms to put in. And they're categorized sort of preset terms. So there's a website you can go to actually look up mesh terms to find which ones are most appropriate for the kind of keywords you're looking for. And then the other kind of term is a keyword, and this is just the search terms that you would put into a search engine such as Google that you probably do every day, many times. And you'd also use these if you're searching literature outside of health. So if you're searching on Web of Science or another source for the planning literature, for example, you would not be using mesh terms because they're specifically related to health. They are a little bit less specific, so they can be useful for incorporating additional things into your search. So the search terms relate to your topic and relate to your research question. There's another piece of it called search operators, and these are additional words and tools to help you structure your search, and I'll just explain that with a little demonstration. So Boolean is a name given to the most common type of search operators, and Boolean operators are words like and, not, and or, and also other tools like quotes or parentheses. So just to walk through a quick example, I've taken a search here for bike lanes, human health, and physical activity. And you can see that I have each of those phrases in quotes. If I didn't, I would be searching for bike and lane and human and health all as separate terms, and you can imagine I would find a lot more and a lot of unrelated information. So because I've got the word and in there, I'm only going to find sources that relate to all three of those things. So if you look at the diagram, it's just going to be the things that fall into that middle section that overlaps all three of those phrases. If I was to use or instead, searching for bike lanes or human health or physical activity, it would get all the resources that relate to any of those, so they don't necessarily have to overlap. So I might get one paper about bike lanes that doesn't talk about health. I might get another, a bunch of sources about physical activity in general that have nothing to do with cycling. So it depends on what you're really looking for, and so you'll get everything if you use or. And you can also combine and or to get just the right combination of terms. So, which I've done here. So here I've got bike lanes and built environment, and then I've put human health or physical activity in parentheses, so it will give me things that relate to either human health or physical activity, but also overlapping with bike lanes and built environment. So getting more specific here. And then to get even more specific, you can use the word not to exclude things. So here I want bike lanes, built environment, and human health, but nothing that mentions physical activity, so then I'm just going to get a really specific piece of the evidence that overlaps like that. And you can combine these in sort of any way to limit your search terms and combine search terms. So if you're searching on Google using keywords, there are a lot of really great, sort of fact sheet links on the handout. And it's important to know that searching on Google is different than searching in a research database like Medline or PubMed. First, as I mentioned, it uses keywords and not search terms. And it doesn't have full function Boolean searching. So you can, if you put in parentheses to group things, that won't work in Google. You don't actually need to type in the word and, although you can. It's sort of implied. So if you type in 3 words, it's assumed that you're using and. So if you typed in cycling, health, humans, it would be the same as typing cycling and health and humans. If you want to use the or operator, you have to use all caps. And instead of the word not, Google uses a minus sign if you want to exclude a particular term from your search. The use of quotes is very helpful in Google. And Google also ranks search terms, so the ones that you put first will be used first, so you'll get more things related to those topics. And in addition to just the main Google search engine, there's also something called Google Scholar that you may or may not be aware of. And Google Scholar will lead you to more academic-oriented sources, so not exclusively peer-reviewed journals, but it will certainly get you a lot more of those and put those to the top of the list. So Google Scholar is a really great tool to use, particularly if you don't have access to library databases. So this is Google Scholar, and I think the link is on your handout, but it's just scholar.google.ca instead of google.ca. And a couple things to note when you are using Google Scholar. This is kind of what the main search page looks like. And there's a little box for including patents. You want to make sure that's unchecked because you don't want to find, probably in this topic, a lot of research about patent applications. And then there's a little arrow at the end of the search box, and if you click on that, you'll get a drop-down menu that will let you use an advanced search feature, and that will let you specify things like author and subject and title keywords. So just an example here to show you about using quotes in Google. So I put in a search for 4 phrases here: built environment and human health and air quality and tree canopy, but I didn't put in any quotes. And Google gave me over 31,000 results, which is far too many to be useful, and I'm sure that many of these are not relevant to what I'm looking at. You know, and you can see that from the first one that's up on the screen there. It may not be quite the topic that I want. If I put these phrases in quotes, which is more accurately describing what I'm looking for, so grouping built environment and tree canopy, it brings it down to just over 400 results, which is still a lot, but it's a lot easier to deal with. So Google is just searching for these 4 phrases, not the 8 words that make up the 4 phrases. So a lot more manageable. So the next thing to consider when you're designing your search is, as I mentioned before, your reference software. It's quite easy to learn, at least the basics of it are, and it will save you a lot of time in the long run, both in terms of saving references. So when you do a search and you find some evidence, you can save those sources, and then, you know, a month or 2 months or a year later when you're doing another search that's relevant, you know, some of those you can search your own database to find, you know, other things that you've already collected. And it's also really great if you're writing a report and you need to cite things, it will automatically generate your bibliography, your reference list, so you don't have to retype all of those things in all the time. So really handy. So Mendeley is something that's used a lot. It's free. You can use it as a web-based version if you're not able to download software onto your work computer. EndNote is one of the most common ones. It's what I use. It's great, but you do have to purchase it, so that may or may not be available to you. And then Google has a My Library feature, which I'll show you next, and it's also web-based. So if you are searching on Google Scholar, there's something called My Library, and you can see up in the top left there's a link to that that will get you to your library. And the way you use it, if you do a search in Google Scholar, so back to my search for built environment and tree canopy, say I find this first result that comes up here, health effects of viewing landscapes. If I decide that is really relevant to what I'm looking for, I can click this save link that's at the end of it, and that will then save it to my library. And I can get to my library by clicking on this link over at the side, on the left side, and that will bring me to a list. So if I've saved a number of sources in my library, then and go to my library, it will just list them all out here, all in one place, and then I can click on these links. There's no guarantee that I'll be able to actually access those papers because some of them may require library access, but can certainly get to the references and the abstracts for them. And the other thing that it can do is you can cite things. So you can see under the first one there, you know, one of the options is cite, written in blue. If you click on that, it will show the citation in a bunch of different reference formats, and you can copy that and paste it into a document for your reference list. Or you can generate a formatted reference list. If you're using EndNote or software like that, you can link the Google Scholar library to that. So you just click on, at the bottom there, you know, you'd click on EndNote and it will download a file that you can import into your EndNote software. So moving on to the rest of our search, the last piece of knowing how to put your search together is to be able to evaluate the papers that come up after you put your search terms into your search engine. And the NCCMT has a number of critical appraisal tools that are available, and these are really great if they fit the kind of research you're using and if you have the time and capacity to use them. They do tend to be a bit more suited to health literature and quantitative literature, but they do fit other things as well. So definitely worth looking at that. But I'll provide some more general principles for assessing the quality of your sources. You know, basic things like, is it relevant to your topic, of course, seems obvious, but sometimes it can be easy to not think so clearly about that when we're searching through a lot of sources. So to assess quality, some general principles is to try to focus as much as possible on scholarly or peer-reviewed journals. You want to think about the amount of evidence that you're finding, so are there a lot of papers saying the same thing, and the strength. Are they finding, is the evidence saying that there's a really strong effect of a particular relationship, or is it suggesting maybe just a minor or a small effect? And then thinking about the type of evidence and how relevant it is to your own context is also really important. Of course, applicability to your local situation is very important to consider. And is the research about interventions that are actually going to be acceptable and practical within your local context? So are there politics or social issues in your community that might be different than in the community that the research was done in? That would change whether the results are the same. And, does your community have the capacity or resources to actually implement an intervention? Because it doesn't matter how effective it is if you're not able to actually do it. And then thinking about transferability is also important. So, and thinking about equity and access of different built environment interventions is also really important. And that's been, I think, alluded to in some of the other presentations in this training as well. So now I'm going to go through three kind of common different types of scenarios that come up. So this is getting either too much evidence, too little evidence, or finding conflicting evidence. So I want you to think about what you could do if you do a search and you've carefully crafted your search terms and your research question, and you still find way more results than you're able to handle. You're finding hundreds or thousands, and it's just not practical to review all of those. What are some things that you might do? So one of these is to limit your study type. So what that means, this is something you can do if you're using PubMed or Medline, but you can't do this in Google Scholar. But you can limit, if you're searching journal articles, limit them to summaries or systematic reviews instead of just all the individual studies, because these will be included in review papers. And I'm going to show you some examples of that once I go through these points. Another thing you can do if you have too much evidence is to refine your search terms. So think about being more specific around the kind of interventions you're interested in, more specific about the context or the health outcomes of interest. You can also shorten the time frame, so looking for more recent evidence rather than everything that's ever been published on a particular topic. And then you can specify a location or context, so you might want to look at a particular population subgroup, say children or pregnant women, look at just small communities or large cities. You could limit things to research that's from Canada or BC or some other characteristic that's relevant. So as an example of limiting the study type, this is something you could do in PubMed or Medline, but not Google Scholar. And I'll show you an example based on looking for research about active transportation, because this is an area of built environment that has quite a lot of research around it. So I've gone to the main PubMed search page, and I've put in a search for active transportation and health. So I get 211 sources. So, compared to some of the things we might find in Google, it's not that many, but it's still quite a lot, and it's always best to narrow things down as much as possible. So if you see over on the left, there's a heading at the top called Article Types. I can limit to review by checking that box. and that will just give me review articles. And so now I'm down to 19 review articles about active transportation and health, and that's a really manageable number of probably really solid papers that I can start looking at. Something else I can do, and this you could do in any of the search engines you might be using, is to refine your search terms. So if we're back to Google now, searching for active transportation and health, I start out getting, over 7,600 results, so way too many. So let's get more specific about what I mean by active transportation. So let's clarify that and specify bike lanes. So I put in bike lanes and cycling because I want studies about people actually using the bike lanes, and health. So that cuts it in half, about 3,600 results, still a lot. So let's go to newer research. So if you see on the left-hand side, there's some time frames, and I'm going to click since 2012. So that brings me down to just under 1,700 results, so getting there, but still too many to read. So now I'm going to focus on just Canadian research. So I don't have a checkbox for that, but I can add it to my search terms and add Canada. That brings me down to 815. And if I want to be even more specific, I change Canada to British Columbia, and I get 196 results. So you can see how you can sort of work your way through and find things that are as relevant as possible. So a next situation that's really common in environmental health and with emerging areas like the healthy built environment is you don't find enough evidence to feel like you can make a decision, or maybe the evidence you find isn't quite specific to the question you have at hand. So what might you do in a situation like this? Well, there are a few things you can start with. One is to break your question down into components. So search for evidence on part of the question. So maybe to stick with our active transportation topic, you might search for evidence on fears of cycling in traffic and cycling rates. Another thing you can do if you don't have enough evidence is to think about different types of evidence. So there's another presentation in this training by Brent Harris who was talking about different data sources you can use. So consider using data around maybe local government data on the number of cycling counters that might be in a city versus actually looking for research papers. You can also think about, different types of knowledge, so going to expert knowledge as evidence and looking at context. You could also think about, what's the infrastructure or the land policies in your community? What kind of things are community groups asking for? That could be seen as a type of evidence of something that might be lacking in your community. Or if you're looking at food environments, you might look to food insecurity statistics to help guide you. So another approach when there's too little evidence is to look for other, atypical sources of evidence than what you might be looking at. So, going to, as I mentioned for data, going to local government, planners, NGOs, community groups. You might go to a different context, so look for European evidence instead of North American evidence. Or you could look at some intermediaries or surrogates for what you're looking for. So this is something we do a lot in environmental health. So if I'm looking for evidence around risk of cancer, maybe instead of cancer rates, I will look for research on fruit and vegetable consumption because we know that that's associated with a decreased risk of cancer. Or looking at physical activity levels instead of outcomes related to heart disease, or exposure to pollutants instead of rates of respiratory disease. So looking at kind of the middle point of things that are also associated. So just, in short, you use the information you have available and just acknowledge the limitations that might be associated with that, and you use what you can. So an example of breaking things down into components when you have too little evidence, I'm going to focus on agricultural capacity, and this is from the Linkages Toolkit looking at healthy food systems, and this was something where we really didn't find a lot of evidence at the time that Linkages Toolkit came out. So one thing, going back to Google here, I'm going to start a search with really broad search terms, so local agriculture or community planning and human health, and then I've put minus sustainability because I don't want to get the general environmental sustainability research. I want to stick to the health research. And I get 1,900 results, but they're not entirely relevant. They're, kind of on the topic, but not quite what I'm looking for. So I want to get a bit more specific or maybe granular in my search to find things that are more applicable. So instead of local agriculture and community planning, I'm going to search for one type of agricultural capacity intervention, and that's farm-to-school program. So I put in farm-to-school in quotes and human health and sustainability. So I get a lot fewer results, 87, and you can see from the titles on the screen they're starting to get a little bit more relevant to the things that we might be dealing with on HPE teams in the health authorities. And then I can go even further. Instead of human health, I start looking for healthy eating or fruit and vegetable consumption. So it's using that surrogate or intermediary outcome. And I do get more results, but they may be more specific depending on what I'm looking for. So you can play around with the right combination to get the information that you want. So the third common scenario is when you find conflicting evidence. So some studies are saying that a particular intervention is good for health, and some are saying it's not, and some are finding no effect. So this can happen for a variety of reasons. Maybe the studies are using different methodologies. Maybe they're in different types of communities where the outcomes are different. And that's why you're getting some negative studies, some positive, and some neutral. So you may be able to sort that evidence according to the different research methods used or the location of those studies to see if things become more clear. It's also important to think about what you're not finding in that evidence. So, does this body of evidence that might be conflicting take into account equity, vulnerable populations? Are there any prospective studies in there? And these are just sort of extra complicating factors to throw into the pot to think about when you're sorting your evidence and trying to make a decision around that. So, regardless of whether you have too much, too little, or conflicting evidence, you still need to make a decision or make a recommendation. And this is a really common challenge around healthy built environments, is you're trying to combine the health evidence that you have available, which might be conflicting or limited, and the realities of planning or local government practices, which tend to be very practical rather than research-based. They want examples of something, whereas as health professionals we usually want really strong empirical evidence. But the reality is that the two groups are now working together, and we need to make some decisions and recommendations that work for both sides. And I found this quote that I thought really summed it up, and it's that urban planning literature normally adopts a deductive expert opinion-based method, while public health is grounded in an evidence-based empirical approach. And this certainly came up a lot when we were putting together the linkages toolkit, where on the advisory groups that were reviewing the evidence, the people from health authorities were really, really wanting strong evidence in order to make a statement, and people who were coming from local governments or planners were really putting a lot of value on, examples and evidence that showed that something had been done before and that it worked, and that showed how something could happen. And those are both valid, and the trick is to just acknowledge those two different paradigms and find a way to work together and make decisions. So in order to make those decisions or recommendations, one tool that can be really helpful is to use matrices, and you can create a matrix in any sort of configuration to fit the particular topic or the particular type of evidence that you've got that you're trying to assess. There are some validated tools to help you do this, and on the handout of links there's something called the NCCMT Compendium of Critical Appraisal Tools, which can be really useful for developing recommendations or decisions out of a body of evidence. and I'm going to do sort of a briefer, maybe more of an ad hoc approach here with these kind of matrices. And these four categories here are really useful things to consider when you're trying to look at your entire body of evidence that you've found on a topic. So looking at how the number of studies, how much research do you have, what kind of research is it? Is it good quality research? Considering whether it's relevant to your local context, either the health circumstances in your community, or whether it's research that was done in a similar type of built environment or community size, say. Looking at the strength of the effect and what was concluded out of those studies, and also looking at what has not actually been studied. So what things are relevant to your question that actually aren't showing up in the literature, which is important to be aware of, because just because it's not been studied doesn't mean that there's not, it doesn't say anything about what the evidence would be really. So it's just good to be cautious about that, particularly in new areas like healthy built environments. So this is an example of a matrix tool that you could use. This is one that I created to sort out evidence around healthy food environments and diet-related health outcomes. So along the left column here, I have what are really different ways of measuring or describing food environments, and this reflects the type of evidence. So if you look into this research, the evidence really uses a lot of different ways to decide what is a healthy food environment, and these are just some of the ways that's been measured. And then across the top row, I have different health outcomes or surrogates for health outcomes. So looking at cardiovascular disease or rates of overweight, but also levels of fruit and vegetable consumption or junk food consumption. And then you can fill in this matrix, these boxes, to help you summarize the evidence that you've collected about how different kinds of food environments relate to healthy eating. And you could fill in the grid with narrative descriptions, so words that describe, the overall outcomes of the research, statistical measures like odds ratios or p-values or prevalence ratings, or you could rank different things or give them a weighting score. And fill them in. And this can be, you can decide yourself how to fill in something like this, but it's kind of a useful tool, particularly when you are speaking to planners. This is a familiar tool in the planning world. It might be called a decision matrix or an objectives alternatives matrix, but it's probably something that's familiar to local government folks. You can use this kind of matrix to bring together qualitative and quantitative evidence. So you might have narrative words in some of these cells, and you might have numbers in other ones, and then you can look at it all together. Can help you incorporate evidence based on different metrics. So here are all these different ways of looking at a healthy food environment, all there together. You can use it to look at different outcomes. So I have some direct health outcomes and some intermediaries or surrogates there. And you can also use it to, incorporate those notes about the context and how applicable something might be. And you can structure this, as I said, in any way to fit the kind of evidence you have, the kind of decision you're trying to make, and what your topic is. So this slide just shows you how you might turn a completed matrix into a series of evidence-based statements. So these are some of the statements that ended up on the Healthy Food Systems fact sheet in the Linkages Toolkit based on this broad collection of research about different types of health outcomes and surrogates and studies of really different kinds of food environment features related to price and distance and density, and putting all that together to come up with these fairly broad but evidence-based statements. So finally, just to summarize this approach, 5 steps that you can kind of think to go through, and these are the 5 steps we've covered. So looking at what resources you have available, getting to know your topic, and then doing all that before you actually start searching for evidence, and important to evaluate and sort that evidence as you search it. And then hopefully I've offered a few suggestions for how to deal with too much information, to kind of limit that down and get more specific, or how to broaden things out and use surrogates and break down your topic if you don't find enough evidence. and then starting to get into an approach for how to incorporate different kinds of information to help you weed through what might be apparently conflicting findings in the literature. So that was a fairly high-level overview, so I'm happy to respond to any questions that people might have. My email address is here, and also to give a shout-out thanks to Michelle Weens, who's the information specialist at the NCCEH, who was really helpful in helping to kind of put together some of this information and clarify things. And I do encourage you to go to the handout for the links there that should guide you through any of these individual steps that we've talked about today. So thank you very much, and enjoy the rest of the presentations.